everyone, and welcome back to our 2024-2025 STEM Talks. I see a lot of returning faces or names, but if you're new here, welcome. Our program, UHN STEM Pathways, is a youth outreach program at the University Health Network, and every month we love to host these fun virtual career panels where you get to hear from these awesome speakers across UHN on different topics. So before we get started with today's event, I do want to quickly acknowledge that today is September 30th. So in Canada today, September 30th does mark Orange Shirt Day, or it's also known as the National Day for Truth and Reconciliation. So with that said, this day is held in honor of all the Indigenous students who were impacted by residential schools in Canada. So Orange Shirt Day in particular has been held since 2013. It's an Indigenous-led commemorative day that celebrates the idea and the movement that every child matters. And on September 30th, we wear our orange shirts to kind of acknowledge that and honor the thousands of children and survivors of residential schools. And then in 2021, the federal government of Canada did actually formalize this day as the Truth and Reconciliation Day. So now on September 30th, you might have this day as a holiday to honor and acknowledge this day. So beyond that, I do want to acknowledge that, we are hosting another event, but if you have the time later, or you can scan the QR code right now, we are going to put these links in the chat and also send it an email. And we encourage you all to kind of do your own homework and learn more about the history of this day and why we honor and acknowledge this day today. With that said, I think Michelle's going to put that in the chat after. For everyone who's here for the Certificate of Participation program, while we talk about that briefly, I'm just going to launch a welcome poll to kind of see how you're doing, see if you're new here, and check in with everyone. So you should see a pop-up video for the poll, but quickly, the Certificate of Participation program is a program that we offer between September and June. You can sign up for it on our website or at the link below, and everyone who attends 7 certificate-eligible events during the school year will be awarded a Certificate of Participation signed by senior UHN leadership. In addition, if you are in the SHISM Health and Wellness program, you can also opt to get the Medical Terminology or Lab Practices certificate. So these events typically take place over Zoom after hours, but we also have some in-person events on our website. So make sure you check out our website to find out what's coming up and which dates you can attend. And if you want to scan this QR code, that will take you directly to the sign-up link. So if you are pursuing the Certificate of Participation, make sure you register and make sure you are attending these Zoom events with the same first and last name you used to register. So you need to spell out your first and last name in full so we can track your attendance, and use the same email that you use for each event. And lastly, before we get started, just some quick housekeeping. So you might see them on camera already. We have 3 amazing speakers here with us today. They're all staff and researchers at UHN. They're going to talk about what they do, what their education and career journey was like, and then we're going to get into the Q&A. So if you have any questions for them, feel free to put in the chat. We're going to save those questions for the Q&A portion of this event. But with that said, I'm going to throw it to our first speaker for today, Sahar.
So my name is Sahar. I'm a scientific associate here at the Ted Rogers Center for Heart Research, as well as an assistant professor at the University of Toronto. I listed a few organizations I work with, but basically under my role as a scientist, I work with Transform HF, the Center for Digital Therapeutics, the Hospital for Sick Children, and the Uganda Heart Institute. So all within the realm of cardiology and digital health. Within my role at U of T, I also work with the Institute of Health Policy Management Evaluation, as well as the Wakapa Institute for Indigenous Health. But beyond that boring stuff, I'm a second-generation Canadian. I was raised in Milton, Ontario, way before it became gentrified. When I moved there, it was all farmland. We had 1 Tim Hortons and 1 Home Hardware. But originally, my parents were from Afghanistan, and I really like to reflect on my cultural roots of where I come from, as it shapes a lot of my priorities and values going into research. I've been working at UHN since 2018, and I've been living in Toronto since 2017. I am the middle child with 0 authority and 110 responsibility among 5 siblings. I'm a big foodie. I love food, but I like to say I'm culinarily challenged, meaning that I can't cook, but I wish I could. And for me, my mental health retreat is I love going to music festivals. It's a nice escape for me. And I ha don't have any major cool pets, but my goat's name is Vogue, as my family has a farm, which is my fun fact of the day. So as you can see, like I come from a really big family, and for me, my identity and my priorities really stems from bringing both my personal and professional life together. In terms of education, I started my undergrad back in 2012. I did my bachelor's of science in biomedical science, and I did a minor in theater just because I'm a bit of an arts weirdo, as I like to call myself. And then I did my master's degree at McMaster in eHealth, which is a shorter term for health informatics, where I specialize in health science and engineering. And then after my master's, I started my PhD during the cusp of COVID, where I just started in health services research with a specialization in health informatics. So I've basically been in school for a very long time, but the journey ahead has really landed me on this topic of work that I like to call equity and innovation. A lot of times when we think about technology and all of the cool things that comes with these advancements, we forget to think about the people that are being impacted by it. And it's usually communities that are underserved or under-resourced, those who are low income or come from different demographic groups that really face the most obstacles. But when we think about innovation, it really caters to the more high income, high literacy people. So for me, my topic of work and my research interest is really looking at figuring out how does things like racism, colonialism, different social disparities really affect and lead you to outcomes such as chronic disease, such as cardiovascular disease, diabetes, depression, and risk. And in this middle part, I really try to focus on how do we motivate health behaviors in a strength-based fashion. So to give you some examples, as part of my doctoral work and my current research program, I really focused on heart failure and cardiovascular disease and how we can use things like a mobile phone, which is pretty much accessible in many homes, whether it's the most advanced iPhone or the older one. We still have, access to these resources that might be able to give you a touch point of care. But the challenge is that a lot of the times these type of interventions and programs, they're not designed for people like my parents or my grandparents. So as part of that, my work has really been focused on working with communities that are underserved. So these are two pictures. This is one in Northern Ontario in Moose Factory, which is right on that cusp of Hudson Bay. And this is in Northern Uganda. And for me, I wanted to figure out how do we redefine what equity and innovation means? And I really find it's redefining, how do we meet people where they're at? By using methodologies like sharing circles, focus groups, going to places that are safe places and having conversations to direct and design, what are the priority areas? What's the research question and whose research or whose program does this belong to? Is it, UHN, the institution, or is it the community that needs the support? So as part of that and my research, I've tried to think through how do we use methods like indigenous methodologies, different culture demographics, to really redesign interventions. So as you can see here, we have an example called our Medley program, which was a digital health program for heart failure, but we had it translated into Cree, which is one of the common indigenous languages in the North. And then we also had our Medley program adapted for a feature phone like the Nokia. You guys might be too young to know, have used a phone like this back in the day, but we had basically everything stripped to make it accessible for communities in Uganda. So for me, when we're thinking about equity and innovation, it's not about, what is the most fancy, most advanced tool or technology, but it's how do we take simple adjustments and learn from the people that need support to define what those design requirements should be. In addition to that, like I mentioned, I did my minor in theater, so I have a little bit of an arts background. I can guarantee you that, when you get a report or you have some pamphlet at a doctor's office, you might not necessarily read it at home. So one of the other pieces of my program of work is how do we create education in a more impactful and welcoming format. So as part of one of the pieces of our Indigenous work is we took all of our findings from our studies and we actually had it translated into a comic format. So this is all created using a Cree animator, a Cree designer, and taking all of that feedback and really showing those stories in a more appealing format. In addition to that, we actually created an animation, really building on that theme of storytelling to figure out, how can the community see themselves represented in a positive way by using things like symbolic animals and really thinking about how do we have these lessons learned, these educational teachings, but in a way that gets people excited. No one wants to read a black and white report, and for me, that's really redefining what equity is, meeting people at where they're at in a way that's more welcoming and encouraging. And just as a summary of that, our animation that we actually had developed was actually filmed and showcased at the Toronto Shorts International Film Festival. So I just wanted to give a few little tidbits of some of my work and what it can produce. I like to always throw weird ideas that might get the team a little confused, but it's those weird ideas that get you into some inclusive rooms. In terms of a week in the life, I separate my time between research and teaching. As I mentioned, like I do a lot of my work in Uganda, so we have a lot of collaborative meetings across multinational teams. It involves a lot of writing, both grant writing, manuscript writing, and I think the entirety, I would say 90% of my time is spent on collaborating with new partners for co-creation, from the ideas that are generated and things that are produced. All of it's done in collaboration, and I think that's really the importance of my week in life. In addition to that, I do a lot of travel. I'm probably out of the country at least once a month by going to different local sites, whether it's Northern Ontario or across the ocean. And then beyond that, I also do some teaching at U of T and at McMaster. In terms of mentorship, I teach a few biomedical engineering students and public health students building on this program of research, as well as thinking about how do we build capacity for international trainees. I'm going to stop there. I can talk for hours because in secret, I'm a big undercover nerd, but I'll pass it along to the next speaker.
So my name is Matt Clifford. I'm PA. For those of you who don't know what it is, a physician assistant. I work in cardiology at the Toronto Western Hospital. So a little bit of background about myself. So I was born and raised in Orillia, Ontario, about an hour and a half north of Toronto, if anyone knows where that is. And if anyone has a cottage in the area or has traveled through there and you're aware of Weber's, that was my high school job. I worked there for 5 years, so chances are I probably cooked you a hamburger at some point. But I moved to Toronto in 2023, and that's actually when I started my role here at UHN in the cardiology department. Typically on the weekends, I'm either trying a new restaurant or at a Jays game, although it was a disappointing year this year. And in my free time, aside from, sports is a big focus myself. I enjoy traveling, and in the winters, I snowboard. I guess on the theme of fun facts about myself, you can see in the bottom right here, I actually was fortunate enough to play for a hockey team from Dubai, and I played in 2 international tournaments in Germany. That's my fun fact of the day. Oh, sorry, I don't know why it's not letting me go to the next slide. There we go. Perfect. So in terms of education, so after high school, I went to Carleton University. At that time, I completed a Bachelor of Health Sciences degree in honors and a specialty in concentration in health throughout the lifespan. And after that, I went to University of Toronto, where I completed the Bachelor of Science in Physician Assistant. Kind of transitioning into the next slide. So what is a physician assistant? It is a relatively new profession here in Canada. At the bottom of the screen, I point out there's typically only about 700 to 800 of us currently working in Canada, and it's not necessarily well known. So what we are is that we are healthcare professionals. We practice medicine, and I work within a healthcare team, and I work as an extension of a physician. As a result of that, I can diagnose, I can prescribe, and I can treat patients just as a physician can. And I'm just associated with them. The whole idea is that we're interdependent and we work together. Obviously, with our healthcare system right now, there's a lot of issues pertaining to access to care, wait times, patients not being seen, and it takes new and creative ideas to help solve that issue. And the whole role of a physician assistant is hopefully to address that. It's been around in Canada for about 15 to 20 years. Throughout that time, there's typically only 3 schools for it in Canada, one of which is University of Toronto, McMaster, and University of Manitoba. Fortunately enough, just this year, it actually increased. The University of Calgary and Dalhousie has since opened up a school. And in the next year or two, University of Saskatchewan will also be opening up. One of the pros of being a physician assistant is that I have the ability to work in any medical specialty I choose to, as long as there's a supervising physician, whether that be cardiology, internal medicine, family medicine. Some PAs work in morgues, helping with autopsy. The options are really endless, which was one of the main attractions for myself. And I'll get a little bit more into that after. So my role in the cardiology department. So at present time, so I help to lead a team of internal medicine residents. Typically, they're PGY1, completing one of their cardiology rotations. Usually, there's about 3 of them and myself, and I help to run, dividing up the daily tasks, figuring out who's going to see which patient, figuring out, who's going to see new consults, things like that. At Toronto Western, we have about a 12 to 14 bed inpatient cardiology unit. We see a wide array of different conditions. We help to manage heart attacks, whether that's when someone's presenting to the emerge with a heart attack and needs urgent care, or whether they've, since been brought to Toronto General and got stents put in to open up the presumed blockage in the coronary artery, helping them to manage them post stenting once they've come back to Toronto Western. We also help manage heart failure patients, patients with arrhythmia such as atrial fibrillation, VT, a number of different conditions, which all lends to say that every day is different. Every day there's a new case, and every day is an opportunity to learn. Specific to the role itself, so like I said, typically, for example, when someone comes into the emergency department, let's say with heart failure, the emergency doctor will start the initial workup to start treating them, send off lab work and things like that, and they'll page myself for a new consult. We'll go down to emerge. We'll see that patient. We'll sort out their treatment plan, what medications they should be getting, which tests they need, any other investigations like that. We'll admit them to our service. Now they're an admitted inpatient on my service, and we'll come up and take up one of those beds. And then throughout that as well, we also do consults throughout the entire hospital, whether it's someone who's just completed surgery, who's having chest pain concerning for a heart attack, they're having an arrhythmia such as atrial fibrillation, which is to say that their heart rate's quite high. It can get up to about 150 to 200 beats per minute. Whatever the concern is throughout the hospital, we see those patients as well. So every day is very unpredictable. Every day is a different day, and that's part of the attraction of why I also chose this role, is that that kind of understanding that you don't know what's going to come through the door, but thankfully you have the resources, the skills, and the knowledge to help care for them. Kind of a typical day for myself. So I start at 8 every morning. We go in, we get the handover from the resident who was on call overnight, whether that's any updates, telling us about new patients, treatment plans, things like that. Following that, we kind of divide up the patients and then figure out who's going to see who for the day. Just kind of helping to create good workflow for the day. After that, we round. So I review blood work from the day, what's come back, make appropriate changes to their treatment plan from that. Oftentimes it involves calling other services as well. If you need an opinion about something, calling family members, making sure they're updated, making sure they're aware of what's happening with their loved ones. We do a multidisciplinary round. So I meet with social workers, physiotherapists, occupational therapists, pharmacists, make sure that everyone's on the same page and that they're kind of getting holistic care. Although some patients, coming in, for example, just with heart failure, you want to make sure you address the entirety of their care, whether that's from a functional standpoint, they're not doing well at home in terms of moving around, there's concern about falling, they need supports at home, really addressing all the needs of a patient, and making sure that when they do go home, it's safe for them to go home. After that, again, we're seeing patients and rounding, and typically in the afternoon is when we will kind of see those follow-up patients throughout the hospital. And I did put, you can see ... and then cardiology stats the emerge, typically as well, maybe once a day or ever so often, that kind of that classic, announcement over the PA system in the hospital goes off that you kind of see in movies and TV shows. And although it's not all the same, it typically is cardiology stats the emergency department. So we drop everything we're doing. We run down to the emergency department, and we see where we can help out. For example, it's often someone with who's having a heart attack and needs urgent care and needs urgent, stenting. So putting in almost like a little tunnel into the coronary artery to open up that blockage and help them out. And after you've kind of settled down from that whirlwind, kind of initial adrenaline rush, speaking to the patient, making sure they're on the right medications or being appropriately treated. You take a big breath and you go back to the rest of your daily tasks. So it's you never know what's coming in. With that's part of the enjoyment for myself. And then typically at about 4 p.m. I get to go home and enjoy the night. And again, going back to why I chose to become a PA, and again, touching on that, kind of the idea that maybe not a lot of you have heard what a PA is that it's the ability to practice medicine while also maintaining a work-life balance. So when I was an undergrad, I can't necessarily remember exactly when I heard about the PA profession, but I remember just sitting there thinking that's what I want to do. I always wanted to be in medicine, but I think the hours, the training, that kind of sense that once you pick a specialty and you start to train for it, you can't switch. And one of the good things about being a PA is that, as I highlighted in my day-to-day, is that I'm 8 to 4, I'm Monday to Friday, and I'm able to have a life outside of, practicing medicine, which is very appealing to myself. There's also the opportunity to have a lot of flexibility and lateral mobility, meaning that for myself, if, for whatever reason I didn't like cardiology tomorrow, I could switch and work in emergency medicine. I could switch into internal medicine. I wouldn't have to go back to school to do more training. So that was a key factor in my decision to become a PA. The program duration itself is only 2 years, as opposed to, obviously medical school, which can be 3-4 years and plus multiple different years for residency and additional training. Another key thing is that the PA profession, like I highlighted, is very new. It's still in Canada, and the opportunity to be a part of one change for healthcare in Canada and making a positive impact for patients. It's also an incredible opportunity to be on the forefront of something and taking ownership of that and helping to create it into what it could be potentially. And that was very appealing to myself. And again, at the end of the day, which I think what drives anyone to work in healthcare or medicine or any related field is the opportunity to make a difference and help people at the end of the day, whether it's a heart attack, again, an arrhythmia, someone coming in with heart failure. You see them come into the emergency department, you see that they're quite sick, you see that they're unwell, and it is rewarding, when they walk out of the door and they're feeling back to their baseline, and they can go back and return to doing the things they love. It's a very rewarding feeling getting that, which ultimately is why I chose to be involved with medicine. Perfect. I think that's it for mine. Let me.
Hi, everyone. I'm Sarah McDermott-Flabby. I am currently a nurse lead for the Peter Monk Cardiac Center Nursing Clinical Coaching and Mentorship Program that is being conducted as a research study in our organization. And prior to that, and currently, I'm still the advanced practice nurse educator in the Toronto General Emergency Department. So a little bit about myself. I was born and raised in Rockwood, Ontario. So if you hadn't heard of where Matt is from, I would be very pleasantly surprised if you are aware of where this little town is, but it is between Acton and Guelph. And fun fact, if some of you know where Cheaper by the Dozen or the Jonas Brothers filmed Camp Rock, it was right down the street from my house. I've been working at University Health Network for since 2014, since I got my first nursing job there on the nursing resource team, and I've lived here ever since. When I'm not at work, I enjoy traveling and really trying to immerse myself in nature, hiking, paddleboarding, rock climbing, things like that, and spending lots of quality time with my friends and family. And my recent rescue dog, who is toothless, named Goya, and also practicing my Duolingo streak, which is 210 days and counting. And because it's National Heart Day, I thought I would share one fun fact that on every single trip that I go on for the last several years, I find naturally heart-shaped, but not accurately heart-shaped rocks wherever I go. So my education, I went to Western for my undergraduate Bachelor of Science in Nursing. I then took my graduate studies to formerly Ryerson, which is now Toronto Metropolitan University, and I received my Master's of Nursing in Leadership and Education and did a thesis on nursing retention in the Nursing Resource Team Flip Pool. And so a little bit about my journey. It hasn't always been linear, but it has always been at the University Health Network, which really just speaks to all of the opportunities that are within our organization. So I started here as a registered nurse on the nursing resource team, where I floated to about 20 different units across Toronto General and Toronto Western, including all of our cardiac inpatient units. I then became a patient safety specialist here, where I would investigate and support any incidents that happened where errors in practice occurred, and kind of educating staff and the organization on how we can improve. I then, and most recently, have been the educator in the Toronto General Emergency Department for the last 3 years, since April 2020, in the height of COVID. I'm also a sessional clinical instructor and professor at George Brown College, and also recently an adjunct lecturer at U of T, and currently in my role as the nurse lead for the coaching and mentorship program in the Peter Monk Cardiac Center. So the topic of our research is really about nursing retention and well-being. And I think through the pandemic, this has really been a really big focus in the organization locally and also nationally in healthcare. And the Peter Monk Cardiac Center has just recently been recognized as a top cardiac and cardiology program in Canada. And we are one of the top specialized hospitals in cardiac care. And so one of our biggest things that we are trying to address is how does implementing professional development, such as coaching at the bedside for novice nurses, as well as mentorship for more experienced nurses, really improve their well-being and retention in our organization, particularly in cardiovascular care. So how do we redesign the work experiences of nurses to really improve their job satisfaction and their well-being while they're at work, so that we can hopefully also have a positive impact on the patient care delivery that we do. So a week in the life right now is really about conducting research activities. We are really in the throes of our research study, so it's about recruiting participants, where there's novice nurses, experienced nurses that work across all of our cardiac units at UHN, including our ICUs and our inpatient units and cath lab, facilitating workshops. So I designed educational material for our coaching and mentorship programs, where I facilitate what that kind of skill and design looks like to be a coach or to be a mentor in the program. I also connect participants and unit leadership to understand what the program is about and what the role and responsibilities is for. Reviewing data entry, so that is something that I am very new to, and always learning about how to actually look at the data and see it in a meaningful way. Supporting program progress and development, so this will be under study for about 2 years, and also consulting and collaborating with other organizational initiatives that we have going on to support nurses and retention in the organization. And also preparing to share our work locally and internationally. I also just last week submitted an abstract for our presentation to go to Finland for an international nursing congress, which is all about nursing well-being and retention as well. And on the side, I also do mentorship through U of T's master's program within the organization for colleagues and previous nurses that I have supported in different roles and aspects of their career. So why I chose this career: I'm a very extroverted people person. I really love supporting people to grow and find what's meaningful to them. I really like to see how people can share their kind of goals and what they want to achieve in their career, and really support them to do that and connect them and network them to opportunities in the organization. I find wherever my career has taken me, it's been mentally stimulating and really meaningful. In all of my roles, it's all been about improving quality and safety for our patient care. In the emergency department, I was developing simulations that really helped guide our cardiac care, how we do CPR, how do we better respond to code blues, and when patients present with heart attacks, how do we get them quickly to our cath lab for treatment, and really just constantly trying to improve and contribute in a meaningful way to our patient care. And always there's lifelong learning. There's always professional development opportunities occurring. I'm never stopping my own learning. Even just in this role, I'm learning tons in the last several months that I wasn't doing before. And also just an opportunity to contribute to evidence-based research, to consistently contribute to our own nursing research, our medical research, and really instill that change in our healthcare system. I think that's it for me, Tricia.
We're going to get started with our Q&A portion of the event. To start us off, I saw from the pre-submitted questions, a student asked, do you find time to rest? What do you do outside of work? Or are you working 24/7? So maybe we'll start with Sahar first and go in the order of speakers. Sahar, how's your work-life balance?
It's a work in progress. That's the way I like to summarize it. To be honest, like there are weeks where I work a lot of overtime, and because you're salary based, you're not being paid for those extra hours. But there's other weeks where, I'll be traveling and I'll be doing site visits, and although I'm on the clock, it doesn't feel like work just because I very much enjoy being present, being in the field, being in community. But I will say, like this year, I've made it a big commitment to try and have a better balance. So I close my laptop on the weekend. I don't work on the weekend. That's my goal, and I've been committing to it. But to be honest, because I'm more in the academic space, there will be times where you have something like a grant deadline, and the deadline is the deadline. There's nothing that you can, push back on it. Or when you're going into community or helping a patient or someone that needs that support, it's really extra time that's out of your day, but it's meaningful time out of your day. So I guess it's a lot more work sometimes compared to other jobs, but I think if you're really invested and you see the impact it has at the time that you give, sometimes it doesn't feel like a burden.
Thank you. And what about you, Matthew? I think I saw someone ask, when was the last time you went home? How's your work-life balance?
Yeah, no, definitely. I think it's a good question because I think that's very important. Within healthcare, for myself, it was one of the reasons that I chose to be a PA, knowing that, it is a little bit of an improved work-life balance compared to, physicians and things like that. So again, it's part of the reason why I chose the profession. Obviously, within healthcare, I have these conversations sometimes with, trainees that are coming through. Ultimately, at the end of the day as well, I think boundaries are important. Specifically, in a healthcare role or providing care to patients in the hospitals. That regretfully, the fact of the matter is that there will always be a patient. If you stay late, there will be another one. If you stay late, there will be another one. There's always someone that needs care. It's unfortunate, but understanding that there are boundaries. That when you leave. So for example, when I leave at 4 o'clock, there is a resident there that's on call overnight, and that's the reason they're there. So it's very important to set boundaries. To kind of speak specifically to the question, there are times for sure where you stay an hour, 2 hours later, just sorting things out. But ultimately, it does come down to boundaries and understanding, what your role is, and that, the more you work, the longer you stay, whether it's 1 day, 2 days in a row, 3 days in a row. It's only going to affect you on those following days when all of a sudden you're tired. Maybe you don't have as much patience because you stayed late. So the big thing is boundaries and finding a good balance.
Thank you. And Sarah, I saw you nodding along.
Yeah, I think boundaries are a really, really big thing that consistently healthcare workers just in general are always practicing. And I think that's just because we are givers by nature. I think for myself, finding a career and going towards careers where I work in the daytime. I worked almost exclusively nights for a very long time. And for my own mental health, that wasn't great. I realize I'm like a plant. I need sunlight and I need to be outside sometimes when there's other people at the same time. So I had to start making career changes that aligned with that. Also, just taking time to do things that bring you joy outside of your work. We can't all be on all the time in our work, or that can really burn you out, even if you really enjoy the work that you do. So finding time to really go for a walk, go get a coffee with a friend, whether that's going to yoga or doing whatever it is that brings you joy or peace, is really important, and really kind of winding down. I find also, taking the time to step away from technology, even though we love our phones, and sometimes, scrolling and doom scrolling on your phone is not necessarily relaxing. So taking that time to disconnect and be at peace with yourself is really, really important as well.
Thank you. And I see a lot of chat questions are coming in. I'm going to try and get to them in order. I think I see someone here asking, is there any advice for students looking to pursue the health sciences, or in particular your fields of study? So maybe Sahar, do you have any advice first for students looking to pursue your field specifically?
Yeah, I would say for me, I think the best advice I got was to really try to take courses and volunteer and work in areas that are less on the traditional path. During my undergrad, I did a minor in theater, and I found that really helped build my confidence in speaking, talking to different stakeholders, just getting myself excited about work. And then also, if you have a passion or something that you have a hobby, really challenging yourself and thinking about how can that make bring that part of my main work. For me, I'm not an artist, but I've always loved animation. I've always loved graphics. And I really wanted to see how can I bring that into my own work life and with the proper funding and with the right people in your corner to really see what your ideas are bringing about. I find that that is my favorite part of my day. Getting to, see people's stories translated into a way that gets me excited. So I'd say whatever your interest is, go take a class, go volunteer, put yourself in a position that might feel uncomfortable at first, because I can guarantee you it's those uncomfortable environments that really try to get you up in the morning. And also, if you have, a specific tie to, your own community, your community group, whether it's a church, a mosque, a center, try to, do your part as well, because we're increasingly trying to find, youth engagement, people who want to be leaders among their communities so that we can bring services closer to home. For me, I'm working with Black Health Alliance as well as a few Indigenous community groups, and we're always looking for someone who can be a translator, who can be a navigator, really be that safety net for people to feel more comfortable in asking questions and asking for support. I see that in myself when, I'd take my parents or my grandparents to, the doctor, and even though they speak fluent English, there's still like that white coat syndrome where you're afraid to ask the wrong question. So if you feel that you can be kind of like a champion for your own community, I'd really, put yourself in that position, because you'll see that your presence really makes a big difference and your time is being well spent.
Thank you. I think that's a great piece of advice. Matthew, do you have anything different to offer or specific maybe to the medical pathway that you took?
Yeah, I think one of the big things is initially, especially when you get started, you may think you like something, and I think that's great, but not to become too focused on one area, especially while you're going through training or school or whatever that may be. It's important to keep your mind open. You may become very focused on something and think that's what you want to do forever, but you're kind of missing out on the opportunity to put yourself in a different area and try something new. And ultimately you may get, wherever that may lead you and realize that maybe I don't like it as much as I thought. So I think keeping your mind open and learning or leaning into multiple different opportunities. At the same time, I think a big thing, kind of branching off of what you like a little bit, maybe it goes against what I kind of said, but at the same time, is that our healthcare system is so quickly and rapidly changing, whether it's with technology, whether it's within research or just patient-centered care, that there's so much opportunity to create a niche or address an area that you may find super interesting, that applies to our healthcare system. Because patient care at the end of the day isn't one like it's solely centered on one aspect. It's not just a disease, it's not just a medication. It's multiple different, aspects. And I think all three of our experience and, where we come from, our professions, show that is that it's multimodal, it's multi-specialty, and that you can create your own opportunity or kind of your own niche within healthcare, and being open to that and figuring out what you like and applying to that. Don't sell yourself short or think, maybe there's not a role for that. Create one. It's our healthcare system's rapidly changing, and I promise whatever you bring to the table will be welcomed.
Thank you. And Sarah, what about you?
Yeah, I think for me, if I think way back to when I was in high school, I actually did a co-op at my hospital. Right before I decided to go into nursing, I was really into art. Took every art class. I was a really strong art student, and I was about to go to OCAD, and I was deciding whether I wanted to go to OCAD or I wanted to go into nursing. And it was actually watching my grandmother in hospital that really solidified that for me, and wanting to actually get an idea of what that might be like in a hospital setting before I actually applied. So I spent 3 months in a co-op from high school doing that, and that really changed everything for me. I shadowed absolutely everywhere. I delivered a baby. when I was in high school. I've never done that in my entire nursing career. So I had a lot of really amazing experiences, which really just solidified that that was what I wanted to do. And I was exposed to a lot of different places, the emergency department, for instance, where I fell in love with that. Cardiology as well, and just volunteering. I've seen in the chat lots of people saying they volunteer, and I think just immersing yourself in that environment can really be just helpful interacting with patients, whether it's just wayfinding to the Tim Hortons in the hospital. You make a difference in that and that patient's experience, and it also helps you to network and make connections with other people in that organization, whether you start as a volunteer and then you want to become a clinical extern, for instance, or a constant observer where there's patients that might be a little bit more confused that need someone to be with them overnight. You can be in those roles from high school or university that really kind of set you up to have those really meaningful experiences early on.
Thanks, Sarah. And I think delivering a baby in high school might be the wildest career story we've had on here.
Yeah, I don't know the legalities on that, so I won't name the hospital or the high school that let me do that. But yeah, I don't think that happens anymore.
Noted. Yeah, I do see a lot of questions about volunteering in high school or co-op in high school. So just quickly to address that, you can volunteer at UHN as a high school student. You do have to be 16 plus. So if you Google volunteering at UHN, it will take you to the website. You can apply. Just make sure you meet the age requirement and you check out what other requirements they have. And in terms of co-op, your high school co-op teacher or guidance counselor would be your best bet because it gets arranged directly with the school. But we do have high school co-op students also at UHN. I want to get to one of the pre-submitted chat questions we had earlier. So someone was asking, what's the biggest misconception that you've come across in your career regarding heart health? Are there any big ones? I'll give everyone a minute to think. I think, Matthew, you look ready? Okay.
I did see it before, and I was kind of thinking about it, so I guess maybe I cheated a little bit, but I think one of the biggest things that I've noticed is surrounding age, and the idea that, just because you're young and healthy, and I apologize, I don't mean to give anyone any added extra stress or anything like that, but that, just because someone's young doesn't mean they can't have heart conditions or heart issues. I think I see that commonly in the emergency department, for example. You have a young person come in, they're describing palpitations, which is a feeling of like your heart beating fast or something like that, and it's just chalked up to anxiety or something like that. But I would say is that regretfully, despite age, people can have serious heart conditions, and I think it's important that if people are worried or anything like that, that they do get checked out for it. But definitely surrounding age.
Are we going in any order?
No, you can go ahead.
Okay. You stole my answer, Matthew. I would also just say just lifestyle. Again, it kind of goes with age, whether you're old or you live a certain lifestyle. Again, it really depends. And just coming from the environment of the emergency department, I've seen a lot of people who, have made not necessarily correct lifestyle choices, but there's people who've made all the right lifestyle choices and are generally healthy no matter the age, and things can happen. So I think it's just keeping that in mind is really important, and not being biased to certain individuals as well.
Well, you guys hit on the good ones. So I'll just also maybe say genetics. Like for me on my dad's side, my mom always will be like, yeah, your dad has all the heart conditions and then we have all the conditions with the brain. So I'm like on a catch-22. So I think for me, like I was always thinking that, oh, no, that doesn't affect me. That's a back home thing. I was born here and I never took it seriously to actually go and get checked or to, push my younger siblings to also have those exams. So I would say if you or a loved one or anyone in your family down the line has, faced something, don't feel like it skips your generation. And not to scare anybody, but, down the road, really be an advocate for your parents and your grandparents to take that seriously. because you'll find more and more that it's, when someone has a heart attack or when someone ends in the emerge that they start to take their health seriously. But the preventative side of things, and if you guys can be the advocate, including yourselves, I would say that's the misconception. It's never too early to go and get checked to make sure your road to health is well and good.
Thank you. And I think this next question I see here might be specifically for Matthew. Do you have to get trained as a PA, similar to doctors doing a residency before you practice, or what's the process like for you?
Yeah, so it's a great question. So PA school, for all the schools, it's a 2-year degree. So the first year is all class-based. So at U of T, they do a bit of a hybrid model where it's online and in person. When I went through, there was only the three schools in Canada. So they did a bit of a hybrid so that as to allow anyone from across Canada to be within the program. So I had a kid in my class from Edmonton, someone from Montreal, and then every month or two for about 2 weeks, we would go in person to learn the hands-on skills. Mind you, COVID threw a little bit of a wrinkle in that, but I think we're kind of clear from that now. Yeah, so the first year is all classes. For myself, there was a lot of recorded lectures from the U of T medical program. So for the first year, and there is no summers, so it is 2 years straight. But then the second year is all clinical based, meaning rotation based. So it is similar in a sense to residency. Obviously not as long and not necessarily in a specific specialty, but we do 10 total rotations. Each one are a month. U of T, you do 5 in Southern Ontario and 5 in Northern Ontario. So I did do 4.5 months up in Thunder Bay in the middle of the winter. It was commonly minus 45, minus 50. But it was a great experience nonetheless. And also I was fortunate enough to be able to go into a couple fly-in Indigenous communities and provide care there for a couple of days, which was a very rewarding experience and something you learn a lot from. But so I guess to kind of circle back to the original question, there is a component similar to residency. It's just about a year long with 10 rotations.
Thank you, Matthew. I have a private DM here that's for Sarah, I think. It's asking because you started as a practitioner, as a nurse practicing, and now you're kind of more in an education role. What made you kind of switch to that, or how was the transition to that?
Oh, that's a great question. I really loved teaching. So when I started as a registered nurse, and you're taught with a preceptor when you get on the job, someone that really teaches you and guides you along the way so that you can independently practice with confidence. And so when the times came for me to have my own kind of nursing student or precept, be at George Brown, for instance, and be a clinical instructor, I really loved being a positive kind of reinforcement and part of that journey for people to feel more confident going into practice. So I think I just started to continue to go down that career path of really wanting to support new learners, making spaces kind of psychologically safe, bringing more fun. I had a lot of not so fun people in my kind of education. So I was like, I just want to be that kind of fun teacher that brings a more upbeat vibe to the classroom or the hospital setting. We work in a very serious environment. And so I really like to look for ways to bring more games and more interaction and team building into that, because you spend a lot of time there. So you should really enjoy the space that you're at and the people that you work with. So that's kind of why I really wanted to be in that space.
Thank you. I see someone here asking about how do you stay motivated in such a competitive and challenging career path? Maybe Sahar, do you want to take that next one?
Sure. I think honestly, one of the biggest lessons I had to learn is if you want to move ahead in your career, you can't do it alone. And really surrounding yourself with people who have the same values, similar goals, and can really be your advocate, the person that's in your corner to be your cheerleader, take the workload off of yourself and share that amongst one another. I think the key thing for me that has really, stabilized my mental health is having like-minded people, having great mentors. Anyone who's pursuing, I think, a research-based master's program or anything, further down the road, whoever your supervisor is or the research team that you're working with, that is the make or break of what your career path is going to look like. For me, like my supervisor was a biomedical engineer and a cardiologist. When I told them about these arts-based things I wanted to do, they definitely gave me some side eye. But I think one of the biggest pieces of encouragement was that they didn't shoot my ideas down. And by having people like that in your corner, it really helps for you to figure out what your niche is and to stay motivated. That you're not going to have all of the answers. There's always going to be someone who's an expert in a certain field, but the people who have that more strength-based thinking, it just gets you more excited to start your day. I have calls that start at 6 in the morning in Uganda, and the nurses on the other end of that call, they're so excited to be able to make a difference, and that gets me excited to wake up that early and be able to figure out what our next step is. But in the reverse, I've also had teams that where I didn't work very well, and you have to be the person to really take a step back and say, this is not good for me. And that's usually the harder decision to make. But down the road, it's a lot more worthwhile to, work with people who support you than, figuring out if the end goal is really worth it.
Thank you. That was a great answer. And I think that actually kind of segues into the question we usually like to end on. So some of you are asking in the chat, how people chose with so many healthcare careers out there, what advice they have for students. So I guess I just want to ask our panelists before we let everyone go, what is one piece of advice you would maybe give to high school students deciding on what to do or what to pursue? And maybe we'll start with Matthew and then go Sarah and Sahar.
I think the biggest piece of advice that I would give is just to believe in yourself. And I know that maybe sounds a little bit corny and kind of, a quote on some mom's wall or something. Because I know my mom puts those quotes up all over our home. But no, seriously, I think that's it's a very important thing is believing in yourself and that, getting into medicine or healthcare related, it does seem daunting. It seems, like, will I ever know enough? Will I ever be able to learn this and keep it in? Am I good enough? Or am I smart enough to get into it? And at the end of the day, if you don't believe in yourself, no one else will. So it kind of starts from within. And if you have a passion for something, you love it and you want to do it and put yourself out there and try.
Thank you. And Sarah, what about you? What's your one piece of advice?
I would say my biggest piece of advice would be take all of your I don't knows and turn them into I don't know yet. There's so much room and so much time for you to learn something, and you're never done learning. Like we are all constantly doing, all of our organizations are working on tons of initiatives, tons of new policies and procedures and healthcare related practices, and there's always ways to continue to learn. Don't stop ever asking questions. People are, I at least find from my students and new hires, they're always like, I don't want to ask a stupid question. Please ask the question because it just means you're going to gain that knowledge and you're going to do something in the right way. So don't ever think something is a dumb question. Just always be open and open to the potential to grow.
Thank you. And Sahar, I know you just gave us great advice, but one more last piece.
I have a spicy one. It might rub people the wrong way, but don't fear rejection. I think that's something I had to learn the hard way. I was often, scared to just like email someone or call someone. But if there's someone doing work that you're really interested in, and they might seem very senior or at an executive level, go and email them. Go and give them a call, reach out to a department. Don't be afraid of not getting a response back because it's better for you to, get that rejection or that, oh, we don't have a position yet than to not know if it'll ever land. 3 of our students who, are in our research program and now have grown into senior positions, they had, sent us a cold email of saying what they're interested in, what they would want to do. So 1, do your homework, and 2, don't be afraid of not getting a response back because you don't know where it'll lead you.
I think that was a great advice and not too spicy, decent advice. With that said, I think we're at the end here. So I want to thank our 3 panelists for joining us, especially at the end of their workday. We appreciate you taking the time to come share your journeys with us and answer all our questions. While we get our slides up, I'm just going to launch a welcome or an exit poll for everyone here. So you should see a window pop up on your screen for Zoom. It's just to check in and see how you found the event. I think Michelle is going to put slides up about our program.
Yeah, sorry, Trisha, my computer's glitching. Just give me 1 second, but I will put them up.
No problem. In the meantime, If you're new here or you're returning, thank you so much for joining us with our first UHN STEM Pathways event of the year. We run events like this all year round. So when Michelle has the slides up, you're going to see a QR code that leads to our website, and that will link to all our upcoming events for the school year. You can also sign up for the Certificate of Participation program if you haven't already. You can also find our STEM Talk dates for the rest of the school year. We also have a Twitter and LinkedIn page, so you can check that out if you want to stay up to date on what we're doing during the week. And then you can also contact us at that email address.